Good afternoon and welcome back to my channel. If you're tuning in for the first time, my name is Erik Schabert. I am a doctor of osteopathic medicine and I have more than a decade's experience in family medicine and osteopathic manipulative medicine. I'm here today to talk about a question I got in the comments page of one of my prior videos on diabetes. This was an individual who has been experiencing a few adverse things and was asking for a little bit of clarification on what to do next. The description of this is that this individual was experiencing low blood sugars previously and had a blood glucose meter as a result, has a low BMI, whatever that means. I'm assuming that means a BMI in the 18.5 to 24.9 range, meaning they're not overweight and they're not obese. They also state that they have some slight elevations in liver enzymes and are having recurrent episodes of low energy in their muscles despite normal sugars when they are checking as they are having these episodes. And this individual is asking, what do I do next? Well, let me get into a little bit of what I would suggest going over with their primary care physician to see if they can get to the bottom of what's going on and feel a little bit better. This individual had done a little bit of online research and had mentioned the possibility of type 1 diabetes, type 2 diabetes, and two other more rare diabetic classifications. One is LADA and the other one is MODY, M-O-D-Y. So let's talk a little bit about what each of those are and why I think that this particular situation funnels in on type 2 diabetes, at least the progression to it. First off, type 1 diabetes is a juvenile onset condition in which an autoimmune attack occurs on the cells in the pancreas that make insulin, resulting in low or absent insulin secretion after meals and elevated blood sugars as a result. Type 2 diabetes, by contrast, is normally of adult onset, although we are beginning to see it quite commonly in adolescents now. Frequently correlates with being overweight or obese, and it's a syndrome in which insulin resistance develops. This means that the body loses its ability to respond to insulin and you get elevated blood sugars as a result. LADA is an adult onset syndrome in which frequently an individual has a little bit of insulin resistance, but then undergoes some sort of event that results in the destruction of the ability to produce insulin normally. And so you end up in a situation where an individual is not making enough insulin, but still has some degree of insulin resistance as well. MODY is an entirely different condition that also results in a reduced ability to produce insulin. The severity of it depends on exactly which of the 14 genetic anomalies that cause the disease are present. And in each of those cases, it is being caused by a single genetic mutation. Okay, so let's talk about what I think is going on in this case. I think in this case, if these symptoms are being caused by a blood sugar related issue at all, it most likely is something to do with the progression towards type 2 diabetes. The reason I say this is the only reason you would get low blood sugars in any of the other types of diabetes is in response to insulin or a medication that causes the individual to produce more insulin. And since this individual is not taking any medications for blood sugars, at least as far as I know, I would suspect much more strongly that this might be something to do with the progression towards type 2 diabetes. It's very common for us in the stage in which either prediabetes is just beginning to occur or we are on the way to prediabetes for an individual to actually produce excessive amounts of insulin in response to a meal, resulting in an initial blood sugar spike that is then more than counteracted by the secreted insulin, resulting in low blood sugars hours later. And having this happening on a recurrent basis could definitely result in feeling low energy or generalized weakness over the course of time. And It's also very common to get that low energy and that weakness feeling as we slip into prediabetes and diabetes. So as far as a workup, the first thing I would recommend is a 2-hour oral glucose tolerance test. Now, this can definitely be something where you go to your doctor and you get an order, you go to a lab, and when you do, what they're going to do is they are going to take a fasting blood sugar to begin with. You do need to be fasting for this test. Then they're going to give you what they call an oral glucose challenge, which basically means they are going to have you drink a syrup that contains 75 grams of glucose. And then they're going to measure your sugars again at the 2-hour mark. If either your fasting blood sugar is in the 100 to 125 range, indicating prediabetes, or is 126 or higher, indicating diabetes, we have a diagnosis. If the 2-hour glucose is in the 140 to 199 range, indicating prediabetes, or is above 200, again, we have a diagnosis. We also could recheck that blood sugar at the 3-hour mark to see if it's slipped below 70, indicating a predisposition for hypoglycemia. So if all of those are entirely normal, the next thing I would recommend is checking a 25-hydroxy vitamin D level, and I would recommend evaluation of sex hormones, evaluation of thyroid hormone, and evaluation for possible sleep apnea. Again, this is something to work through with your primary care physician. They can take the remainder of the history and do a good physical exam, and through that, get pointed in one direction or another. But that is what needs to be done to get to the bottom of diagnosis. Just to go into a little bit of what you could do if certain things come up abnormal. Number one, I definitely would recommend magnesium supplementation with an organic magnesium supplement to try and improve muscle and nerve function, regardless of what's going on with blood sugars or other hormones. I would recommend getting a 25-hydroxy vitamin D level and supplementing with maybe 2,000 international units a day of vitamin D. This could be tailored. If the vitamin D level comes back very low, you may want to supplement at higher levels until that level comes back up to an ideal range, which I would consider somewhere between 50 and 80 nanograms per deciliter. Low vitamin D, 20 to 30 is considered insufficient vitamin D. Below 20 is considered a deficiency in vitamin D. Along with that, so if you come back as diabetic, definitely look at my type 2 diabetes video regarding the EDIC trial and what its implications are for treatment of type 2 diabetes. If you come back as pre-diabetic, there's really good indications that getting on a GLP-1 analog while you are pre-diabetic can prevent progression to diabetes and potentially allow you to intervene with lifestyle. And with lifestyle interventions, we are talking about regular exercise, and I would recommend resistance training in addition to cardiovascular exercise. Ideally, you would do zone 2 cardiovascular exercise with appropriate resistance training. There's a lot of YouTube and online information out there on how to do that appropriately, so I'm not going to go into it. And additionally, you would also want to institute a high fiber, high protein, low simple carbohydrate diet. Well, that is all I have for today. If you have additional questions, please do leave them in the comment section. I will be happy to respond, and that could potentially even lead to further videos if there are complex topics that I think need to be teased out a little bit more thoroughly. Thank you again for tuning in. Please do like, share, and subscribe if you find this stuff helpful, and I really hope to see you back here again. Thank you.